Are you? An older masturbator? I don't greet everyone like this, but if you're in your 50s or 60s or even older and still masturbating, you've probably wondered, is this still healthy? Or maybe, could I be doing some invisible harm? Well, you're not alone. This is one of the most common and least discussed concerns for men in their 50s, 60s, and beyond. So today, let's clear the confusion with real science. No shame, no guilt, no stigma. We're covering 10 surprising health benefits of mature age masturbation and 10 risks you should never ignore. Before that, I'd like to thank you for your company today. Thank you for watching. Please like and comment. We'd love your feedback. And please subscribe to support the channel. It means a lot to us. Thank you. Now back to today's topic. 10 health benefits of masturbation for older men. Let's start with the good news. What masturbation might be doing right for your body. 1. It keeps your penis in shape. Erections equals blood flow equals tissue health. Think of it like regular exercise for your sexual function. Achieving and maintaining erections brings oxygen-rich blood into the erectile tissue, corpora cavernosa, which keeps it elastic and responsive. Why it matters? As men age, reduced sexual activity can lead to tissue stiffening and a higher risk of erectile dysfunction, ED. Frequent erections help preserve both structure and function. 2. It supports prostate health. Ejaculation may help protect against prostate cancer. A landmark study from Harvard found that men who ejaculated 21 or more times per month had up to a 33% lower risk of developing prostate cancer. Why it matters? Regular ejaculation may flush out toxins and carcinogenic substances from the prostate ducts, lowering inflammation and cellular stress. 3. It strengthens your pelvic floor. Your orgasm is a mini workout for essential muscles. The rhythmic contractions during orgasm engage pelvic floor muscles like the pubococcygeus, PC muscle, which plays a key role in erection strength, ejaculatory control, and bladder regulation. Why it matters. A strong pelvic floor reduces the risk of incontinence and can significantly improve sexual performance and stamina. 4. It lowers cortisol. Cortisol is the body's primary stress hormone. So, cortisol down equals calm body and mind. Masturbation and orgasm trigger a natural drop in cortisol. Why it matters? Lower cortisol helps regulate blood pressure, improves heart health, and contributes to better immune function. It also reduces anxiety, which becomes increasingly important in later life. 5. It boosts feel good. Brain chemicals. Orgasm is a neurochemical cocktail. Masturbation releases dopamine, the pleasure motivation hormone, and oxytocin, the bonding and calming hormone. Why it matters. This natural mood lift can help with emotional balance, reduce depression symptoms, and foster a more positive mental state. 6. It helps with early detection. Know your body, catch problems early. Regular self-touch creates greater awareness of what's normal and what's not. Why it matters. Many men first notice testicular lumps, penile plaque, or skin changes during masturbation. Early detection is often the key to successful treatment of conditions like cancer or Peyronie's disease. 7. It improves your sleep. Orgasms make great sleeping aids. Post-ejaculation, the body releases prolactin, oxytocin, and reduces cortisol, all of which promote drowsiness and physical relaxation. Why it matters. Deep sleep becomes harder to achieve with age. Masturbation can help trigger the kind of full-body calm that leads to restful, restorative sleep. 8. It enhances pelvic blood circulation. Circulation isn't just about the penis, it's your whole pelvic system. Frequent arousal and orgasm boost blood flow to the bladder, prostate, and surrounding muscles, not just erectile tissue. Why it matters. Good circulation supports organ health, reduces inflammation, and may help prevent age-related urinary issues. 9. It builds ejaculatory control. Practice makes precision. Masturbation is a safe space to experiment with techniques like stop-start or edging, which help men gain control over their arousal and timing. Why it matters? Learning how to delay orgasm boosts confidence in partnered sex and reduces performance anxiety. 2 major factors for satisfaction later in life. 10. It keeps your desire alive. Use it or lose it. It applies to libido too. Engaging in sexual activity, Even solo action keeps the neural pathways for arousal active and responsive. Why it matters. Just like muscles, sexual desire and responsiveness fade without use. Regular masturbation helps maintain healthy libido, even without a partner. But to be healthy, this habit must be conscious and balanced. Let's talk about 10 things to watch out for. But keep this in mind. This video is meant to educate and empower, not diagnose or prescribe. Always speak with your doctor or a licensed medical professional before taking any action based on the content you see here. Talk to your doctor before you do anything, please. 10 risks of masturbation in later life. 1. Social isolation. Don't let solo pleasure become a substitute for real connection. Masturbation can be part of a healthy sexual life, but when it begins to replace intimacy, emotional closeness, or the desire to form relationships, it can lead to isolation. Over time, the comfort of solo release may reduce motivation to seek meaningful companionship. Tip: make sure solo habits complement your life, not confine it. Social connection is as vital to health as exercise and diet, especially as we age. 2. Skin damage. Be gentle on yourself. Always use lubrication. As skin becomes thinner and more sensitive with age, aggressive stimulation or dry friction can cause micro-tears, inflammation, or even infection. These tiny injuries may not seem like much at first, but can build into chronic irritation. Tip: use a quality, unscented, water-based lubricant and take your time. Sensuality beats speed every time. 3. Desensitization. Don't condition your body to only one method. Repetitive stimulation with the same grip, rhythm, or material, like porn, can cause your brain and body to only respond to that specific pattern. This can lead to difficulty climaxing or becoming aroused during partnered sex. Tip: vary your touch, pace, mindset, and even fantasy. This helps preserve full-spectrum sensitivity and keep sex adaptable and enjoyable. 4. Masked erectile dysfunction. If you can get it up solo, but not with a partner, it's time to investigate. Many men are surprised to find they can achieve an erection during masturbation, but not during sex. This can mask underlying health issues like low testosterone, cardiovascular disease, or performance anxiety. Tip: don't wait. Talk to a doctor. The earlier you address the issue, the better your chances of reversing it. 5. Nerve compression and posture. Hunched over, sitting on a hard chair, you could be harming nerves. Poor posture during masturbation, especially sitting for long periods, can compress the pudendal nerve, which supplies sensation to the genitals. Over time, this may cause numbness, tingling, or pelvic pain. Tip: masturbate in a relaxed, supported position, like lying back on a bed or reclined in a soft chair. Quick pause. This part could really matter to you. If you've been noticing a dip in bedroom performance, whether it's lower drive, less sensitivity, or trouble staying firm, know this. It's a common issue, and you're not broken. You're also not alone. In fact, there's a simple, natural method that thousands of men are quietly turning to. Just a simple home remedy that's ready in a few minutes, you can make at home, designed to boost you in every way. It requires no pills, or pumps, or injections, or surgery, and works by activating what some researchers now call the core male performance trigger, a biological switch tied to sexual arousal, blood circulation, and stamina. Find out more. There's a link in the description. Now back to our countdown. 6. Emotional avoidance. Masturbation should be pleasure, not a permanent escape. If you're using self-pleasure as your main or only way to cope with stress, loneliness, or frustration, it may become a coping crutch that prevents emotional growth. Tip: expand your toolkit. Include exercise, conversation, hobbies, and mindfulness. You're more than your release. 7. Guilt and shame. Unpack old beliefs that no longer serve you. Many men were raised in environments that taught masturbation was dirty, sinful, or weak. These messages can linger and create ongoing guilt, even when the act itself is completely normal and healthy. Tip: consider speaking with a sex-positive therapist who can help reframe those beliefs and replace shame with understanding. 8. Pelvic congestion. Too much of a good thing can still cause discomfort. While regular ejaculation benefits the prostate, excessive frequency, especially several times daily, can cause a dull ache, heaviness, or blue balls sensation in the pelvic area. Tip: pay attention to your body's signals. Rest, hydrate, and return to balance when needed. 9. Fertility impact. Trying to conceive? Daily ejaculation may reduce sperm count. Although masturbation doesn't harm long-term fertility, ejaculating every day can temporarily lower sperm concentration, which might affect chances of conception. Tip: if planning to conceive, aim for 2 to 5 days of abstinence between ejaculations for optimal sperm quality. 10. Porn-induced disconnection. Don't let extreme content distort your real-life expectations. Pornography, especially in its more intense or exaggerated forms, can train your brain to expect constant novelty, unrealistic bodies, or scripted scenarios. This makes real intimacy feel dull by comparison. Tip: balance any viewing with imagination, memory, or mindful arousal. Real connection, emotional and physical, often outperforms fantasy when nurtured properly. Let's conclude by saying, masturbation isn't a guilty habit, it's a tool. Practiced mindfully and in moderation, it supports your sexual health, mental well-being, and physical vitality. At any age, but especially in your 50s, 60s, and beyond, it's a smart, natural, and effective way to stay connected to your masculinity and health. Use it with awareness, respect for your body, and a sense of balance, and it can be a powerful ally for long-term sexual and mental health. If this helped you, give the video a like, subscribe for more science-based health insights, and tell us in the comments, what's one myth you want us to explore next? Stay sharp, stay vital. This is Prime Male Health. And check out the simple home remedy that has already helped thousands of men reclaim their confidence and power in the bedroom without pills, pumps, or surgery. Get more information. Link is in the description below. Thank you for watching. Thank you for your company. Please subscribe. Until next time, take care.